Good morning, everyone. We will give it a couple more seconds as we're admitting people before we get started. Awesome. Okay, let's go ahead and jump right in. I hope everyone is having a great Friday morning and staying safe and sane out there. I know many of you had started back this past week, so I hope your school year has started off wonderful. My name is Stacy Calkins, and I am a school testing coordinator here with OHA. I specifically work on the student screening testing program. I am also joined this morning by my wonderful colleague, Jamaica Baker Flowers, who many have worked with on the diagnostic testing program. A little bit about our role is we are a small team of two, so we work very closely together. Oftentimes you may notice that if you email about diagnostic, you may get a response from me and vice versa. We communicate every day, so we are here to support schools as we move through the 2022-2023 school year. Okay, I'm going to move to the next slide. So our agenda this morning is we're going to go over our testing programs that we're going to continue into this school year. So we are going to continue with our student screening program and with our staff screening program, along with giving you guys an introduction to our regional laboratory partners who we work with on our screening testing programs. And then finally, Jamaica will close this meeting out with information on our diagnostic testing program overview. We have some learning targets as our objectives. So today we would like to help you understand the rationale for including on-site COVID-19 testing in K12 schools, to help you learn the difference between diagnostic and screening testing programs and to understand the benefit of each program, and then to know how the Binax Now COVID-19 antigen test will be performed in a school setting, since there are some updates to that program. We have some testing guiding principles. Our testing strategy is evidence-based and will evolve as data emerges. We really pride ourselves on aligning closely with what the latest CDC guidance is, and we also work closely with ODE on communicating this information out to schools. We also have the following mandate, which is to provide testing to vulnerable and disproportionately impacted communities while improving access to testing for all people in Oregon. Finally, testing alone cannot control the spread of COVID-19. It is one tool among many to preemptively diminish the proliferation of the virus. When testing is coupled with other measures, the spread of COVID-19 is greatly reduced. So this includes masking, vaccination, ventilation, frequent cleaning, and disinfecting, and social distancing for your students and staff. Some benefits of testing for COVID-19 in K12 schools. You will hear us talk about this multiple times throughout this. For some students, COVID-19 testing in K12 schools may be their only access to COVID-19 test, and the importance of this cannot be overstated. The goal of screening testing for COVID-19 in schools is to quickly identify cases before they become outbreak, specifically for asymptomatic individuals. When used alongside other mitigation strategies, such as masking and physical distancing, testing creates an additional layer of reassurance it is safe to keep schools open with students and educators in the classroom and importance, and keep your students safe and healthy. And then finally, safety measures such as masking and physical distancing, coupled with regular testing for staff and students, will allow more consistent access to in-person instruction for K12 students. We are continuing our 3 testing options. So we will continue with our at-home staff screening program. This targets unvaccinated K12 staff. The kits are sent to staff homes and returned via mail. This is a confidential optional program. We will also continue our weekly screening of K12 students. So this can occur in classrooms or at home with the assistance of a parent and guardian. We use our regional laboratory partners for this program, and this is opt-in at a local individual level. We will also continue with our diagnostic testing program via our Binex Now test kits in school for symptomatic and exposed staff and students. For all of our programs, they all are opt-in. You will have to opt in with OHA, and then you will also ask for consent for your students from parents and guardians for students. And parents and guardians in schools can opt out of our programs at any time. You also don't have to opt into both programs. You can opt into one and not the other, or you can opt into both. So jumping into our screening programs, we will talk about the student screening program first. This is a CDC grant funded program for K12 students. The target audience is unvaccinated students. However, we do not verify vaccination status, and so students of any vaccination status can participate. Think of this as an early warning system to catch those asymptomatic cases before they become outbreaks and before other students and staff become sick. I also like to think of this with an equity focused lens. So this is an excellent tool if you have medically fragile students, if you have students that are going home to maybe a medically fragile parent or guardian, students that live in congregate settings such as houseless populations, migrant education students, and then if you work with pregnant and parenting students as well. The enrollment for this program, if you have already been participating in this program, you will just roll over into the 2022-2023 school year with continuing to work with your laboratory partner. If you would like to opt into this program, you must opt in by enrolling via the form on the OHA Youth Program website. And we will reference this website a couple of times throughout this webinar, and so we will put that in the chat. An email will be sent with more information specific to your laboratory partner. Schools will need to confirm that they would like to proceed with the program, and then school information will be sent to regional laboratories, and then they will pick up the logistics from there. Next slide. Perfect. So the logistics of this program, I like to think of this as the big raw logistics, is it's a once a week self-sample collection via saliva sample for students. The goal is a 24 to 36 hour turnaround time. And I know I have some of my laboratory partners on this meeting, and oftentimes last year they were able to process these samples a little quicker. Schools and school districts will work with their assigned laboratory for program design. So this could be the pickup day, who to offer testing to. Many school districts last year, for example, only offered this to elementary school students. Some schools offered it to extracurriculars. It really depends on who your target audience is, and you have freedom in that. And then kit delivery option. Our labs, depending on your location and depending on your partner, have worked really hard for process improvement, and there may be an option for the kits to be sent to the student's home and for the school just to assist with collection. Finally, results will be shared via patient portal to parents and guardians. They will not be shared directly with school. Next slide. So first up, your assignments for this program will be based upon the county of which your school or school district resides, If you are located in Marion County, Polk County, Yamhill, Benton, and Lynn County, your partner for this program will be Rise Laboratories. This was formerly Willamette Valley Toxicology. They have just rebranded. And their point of contact is Aslan Noakes. And Aslan, are you on this call? Doesn't look like she is. So if you have specific questions about logistics, I am more than happy to get you connected to your laboratory partner. If you are in Lane, Douglas, Coos, Curry, Jackson, Josephine, Jefferson, Wheeler, Crook, Deschutes, Grant, Klamath, Lake, and Harney County, your laboratory partner will be the University of Oregon. And the contacts for that are Marta Slattery and Caitlin Lewis. And I do see Marta on this call. Marta, would you like to share any updates about this program with our education partners?
Hi, Stacy. Good morning, everybody. Yes, we are excited to be able to offer the program again. We currently have 12 districts that have opted in and have enrollees. There are a few districts that, although they have opted in, don't have any enrollees yet. And we have 85 schools. So we are ready to start testing next week.
Wonderful, thank you. Up next, we have Santiam Hospital, and this laboratory covers Marion County, and the point of contact is Carrie Barton. I don't know if I see Carrie on this call. And then finally, we have OHSU, and the point of contacts are Dale Ryder and Amy Vesserino. They cover Clatsop, Columbia, Tillamook, Washington, Multnomah, Clackamas counties, along with Hood River, Sherman, Wasco, Gilliam, Morrow, Umatilla, Union, Wallowa, Union, Baker, and Malheur County. And no, I did not do that all by memory. So again, if you have specific questions of logistics for these programs, let me know and I can get you in contact with them. I did see a question in the chat about consent form. You will work with your laboratory partner on consent for students that have opted into this program. Next slide. Awesome. Okay, we will talk about our staff screening program next. So this is a partnership with Rise Laboratories. This is a once a week at home program for school staff. However, staff with any vaccination can participate, even if they are vaccinated or unvaccinated. OHA and Rise Laboratories will not share results with school or school districts, and the results will be shared directly with staff members. Sorry if you can hear my dogs barking in the background. I have some construction going on. So the enrollment for this is staff will enroll by filling out this form, and we will put this in the chat. The onboarding email will be sent to school staff on the email that they provided. Lessons learned from that last year, this email has been known to go to spam or blocked by school firewalls. So staff should check their spam folders if they don't get the email within a week. School staff must follow directions in the email to set up a LabDash account, and then kits will start to arrive within a week of LabDash being set up. One thing to know is when the staff member does collect their sample, they must link their sample with LabDash in order for the sample to be processed. And then to unenroll in this program, school staff will need to contact Rise Laboratories. And again, here's our little cheat chart of our different programs. As you can see, it gives the intended recipients, the location, and how often and how to enroll. This is also on our website as well. And then moving forward, I'm going to turn it over to Jamika to talk about diagnostic testing.
Awesome. Thank you so much, Stacy. Good morning, everyone. Again, thank you all so much for being here with us this morning. Again, my name is Jamika Baker Flowers, and I am also the school testing coordinator here on the COVID Response and Recovery Unit, or CREW, with the Oregon Health Authority. For those of you who have returned to our program again in this school year, and you have been with us in the previous academic years, I want to thank you all so much for still partnering with the Oregon Health Authority. Welcome back. For those of you who are newly enrolled into this program, I want to welcome you and thank you all so much for your partnership with us. I do want to make sure that I adhere to our accessibility guidelines. So I'm going to give a very short, brief visual description of myself. I have on a black top. I am wearing glasses that are the anti-blue light blocking glasses. My hair is brown, auburn colored, about shoulder length. And behind me, you will see a black and white curtain, as well as a photo framed behind me. Okay, so this morning, what I want to do is really focus on a lot of updates that we have for the 2022-2023 school year, and provide as much information to you all as possible that we have at this moment. So within our diagnostic testing program, here you all see a cover of our testing guidance. This week, our testing guidelines were actually updated on September the 6th with some new and forthcoming information. So as soon as that has been made public with the minor changes and updates that have been made, I will make sure, as always, that I send out a mass message to all of you all as our enrolled school partners. As Stacy mentioned before, we're going to refer to our OHA COVID-19 Youth Testing Programs website quite frequently. We are really, really excited and happy about this website that we've had up and running in operation for about a year now. Our K12 OHA COVID-19 Youth Programs website provides all of the information that you all will need and all of our other school partners will need to be able to access any of our registration forms for either of our K12 programs or any of the consent forms that are also available in multiple languages should you need them. As well as any additional materials as well as guidelines that you all may not be able to find that are readily available within the testing guidance. An example of this would be the frequently asked questions. So should you need those, they're available on our website and you can find them where it says OHA COVID-19 Youth Testing Programs. You can find that there. Also, as a note, we are going to send out this webinar. We're going to send this out to you all in addition to a link to the recording once that has been made available, okay? So moving forward, I do want to focus on a couple of other updates with our program. Next slide, please. Thank you. So again, as in the academic years in the past, here we have a copy of our COVID-19 registration forms, right? This is available again within our testing guidance. And just as a reminder, for those of you who were enrolled into our program in the 2021-2022 school year, your school or school district has been automatically enrolled into this current academic year. So there isn't a need to submit an updated or an additional registration form. One of the things that I will note is that if you have new staff members who will serve as a new school testing reporter or school testing administrator, you should send an email to me, either to my personal email address, which I will provide at the end of this training, or to our school testing COVID email account. You're more than welcome to send an email there with that person's name, contact information, email address, so that I can update the record in our database for your school, okay? Next slide, please. Thank you. Okay, so on to our consent forms. So as you all know, our program for the diagnostic testing program, we do require written consent from a parent and or a legal guardian for all students under the age of 15. If there are students who are 15 and older and they would like to provide their own consent, we do have the minor testing consent form available that they are able to sign and complete. But again, as a really critical reminder, written consent must be provided prior to any testing can be administered for that student, right? If it's a staff member who needs access to the rapid on-site testing using the Binex Now tests, they don't have to provide written consent. They can provide verbal consent. That is completely okay for a staff member who's an adult at the school. So 2 updates to our minor as well as general consent forms for this school year, and they are shown on the next slide. Thank you. So as you all will see, if you have not already seen within the updated testing guidance for this year, you will find that there is the QR code that is listed on both the general as well as the minor consent form. This QR code has been placed here for this academic year specifically to collect real D data. So that's identifying information including race, ethnicity, language ability, accessibility needs, disabilities, etc. One thing to note is that when you explain this to your parents and legal guardians, as well as to the minors who would like to provide their own consent, again, ages 15 and older, is that this is not mandatory to complete. This is completely optional, and that information is listed at the bottom under the QR code, or over to the side. You will see that information there. This has been one of the most dominant questions that I've been receiving throughout the summer, as well as now in the beginning of the fall semester. So I really wanted to make sure that I covered that information with you all. It's not required, it's not mandatory, it is optional, but it also helps the Oregon Health Authority to be able to capture as much information as possible about not only the communities that we serve, but also how the agency can do a much better job at being able to disseminate certain services to all of our state's residents. And now we will go to the next slide. Okay, so these are just the updated links to both of those. Again, they are listed in the appendices section of the diagnostic testing guidance. You will find both of these updated forms there. They have also been placed onto our website as well. So we try to list them in multiple places so that you all have access to them whenever you need them, okay? And we will go to the next slide. Okay, so one update to this academic year that wasn't in place initially in the fall of 2021. So here, again, we have our K12 reporting portal. One thing to note is that all positive results must be entered into the K12 reporting portal. In the years past, it was all testing results, both positive and negative. This year, it's only the positive results, right? Also, all positive results must be reported immediately to your local public health authority, or what is known as the LPHA, right? Also within the testing guidance, I don't remember off of the top of my head the page number, but there is the reporting log that you all will have access to. And I think in a couple of slides, there's a screenshot of that. On that log, the school testing administrator, if there are multiple ones within the schools, that's completely wonderful and actually recommended. On that reporting log, we ask that you all keep track of every single time, every single student as well as staff member within the school that is receiving a BinaxNOW test. This is going to help you all down the line when you need to refer back to your information to see who has received a BinaxNOW test on what date, so that you're able to, with ease, enter this information into the reporting portal. There have been times, of course, during massive surges that we've all had, which felt like a lifetime ago, but also just yesterday, that times would be very, very busy and difficult to enter the results daily, right? Of every single person, every single student or staff member that you were testing. And so it's really good to be able to keep track of that information in case you need to refer to it later. But again, all positive results must be entered into the K12 reporting portal. It is very helpful if you're able to have the time to do it every single day, so that you don't lose sight of any really critical information that you need to be able to capture, okay? If anyone has any questions about that, please enter it into the chat. For any reasons, if you have technical issues reporting your information into the K12 reporting portal, I've had that experience many times with schools in the past. And so if you have any issues that need assistance with troubleshooting, please don't hesitate to reach out to me. I will work with our data team to correct those issues, okay? And on to the next slide. Okay, so this is simply a screenshot of our frequently asked questions sheet that we have. This also contains and covers information about the consent form, what is required with that. Again, For students that are 15 and under, written consent is required from a parent and or legal guardian. For students that are 15 and older, written consent is still required, though they are able to provide that for themselves. This includes information about how to properly dispose of testing materials that have been used throughout the administration of that. Also the protocol on how to order additional ones, which we will cover in a couple of slides. It also speaks to any potential issues with the quality control test that must be performed prior to testing. Also, again, going back to the protocol to reordering more tests, we do have our Binax Now reordering form available, in addition to our iHealth self-test form as well. One thing to note, the frequently asked questions form is a live document and it is routinely updated. So any new information that our team receives, specifically from our senior health advisor, then it's constantly updated. Or if there are any new changes to CDC guidelines that our agency, and more specifically our program, is reflecting in our work, then we will constantly update this as well. I do see questions in the chat. Hi, Lori. Thank you so much for joining us. All positive cases entered into the portal, whether or not tested at home or at school. Okay, so can you clarify for me, Lori, about positive cases entered into the portal? So are you speaking about the Binax Now test if they're performed at school versus the self-tests? No, that, so the question is, when a parent calls in for a student who is sick with COVID, is that entered into the portal? The only information that should be entered into the portal is if you all as a school, the school testing administrator has administered the test on site using the OHA distributed Binax Now test, right? There is information in our testing guidance that we included in the spring of 2022, specifically about the use of iHealth test for the what was referred to as test to stay enhanced exposure testing protocol to support that specific testing protocol using iHealth self-tests. It's not required that the parent that information is entered into the portal, although it is helpful. It's most helpful if the self-test has been administered at home and that student tests positive or the staff member tests positive, you still want to relay that information to the LPHA. I hope that that clarifies it a little bit. And I'm going to explain the quality control test very shortly when the form is updated. Okay, Lori, can you explain your third question? When the form is updated, could the updated date be updated as well? You can come off mute if you're able to explain that question a little bit more.
Hi, Jamika. Thank you. I see on the screen where it says COVID-19 diagnostic testing in Oregon schools FAQs, and then it says updated 8/24/2021. I'm wondering if when you update the form, if that date will also be updated.
Yes, absolutely. This is as it very clearly shows, this is a screenshot from one of our previous forms, but each time it is updated, we do update it to the most recent one. So for example, if our senior health advisor received information or provided information to Stacy and I about updates to the diagnostic program today, it would reflect updated 9/9/2022. So the data is also updated each time. Thank you so much for asking that question, so that everyone else would be able to know that, yes, that's updated also. Okay, we will move to the next slide. Okay, so again, this is within our testing guidance. Again, many of you have been with us in academic years past. And so you all are very familiar with this. Also, anyone who has been living in the midst of COVID over the last 2.5 years, we're all very familiar with this information, and specifically regarding what the most common or dominant symptoms of COVID-19 are. And so this is the time in which a school testing administrator, someone who is overseeing the COVID testing process within your school and or school district, this is a time when you see a student, a staff member who is presenting any of these symptoms. This is the time in which you want to administer a rapid antigen test using the BinaxNOW testing, right? What the tests are not to be used for are both surveillance or screening testing. And that information is, again, thoroughly covered within our testing guidance. I just wanted to make sure that I highlighted that specifically because we tend to get this question somewhat frequently, and there has been slight confusion around it, but I just wanted to make sure that we covered that again so that there aren't any areas of confusion on that. So again, coughing, if there's muscle fatigue or body aches, congestion, any of these most dominant symptoms that are presenting, you want to make sure that you assist that student and or staff member with receiving a BinaxNOW test. And again, the faster that you're able to administer that, then the better to prevent the spread of COVID-19. Okay, and then the next slide, please. Thank you. Okay, another question that we have received quite often is on page 15 of the most updated testing guidance. We speak to using expired BinaxNOW tests. Now, the question that I receive frequently is, why is it allowed, or why are we allowed to use expired BinaxNOW tests? And that is specifically because our senior health advisor, Dr. Melissa Sutton, has reviewed this information in depth. And with her medical training, she knows that these test cards and the reagent that is provided, they're still viable to be used past the date of expiration, as long as, oh, can we go back a slide? Thank you. As long as the quality control test has been performed prior to testing. So one of the best examples that I can provide is if many of you all, again, are returning from the summer break, right? Many schools have had unopened boxes of COVID-19 tests for any number of reasons. And if you find yourself needing one now in the fall semester, now that everyone's coming back into an enclosed space within the school for prolonged hours during the day, and if the date of expiration was August the 31st, right? What you want to do is open that box, perform the quality control as noted in the testing modules, which we'll cover in a minute within the testing guidance, and also that is in the information packet in your BinaxNOW testing kit. You want to perform the quality control. If the quality control fails, then that means it's indicating that those tests are not viable. If you receive the result that says indeterminate, if you receive that the first time, our guidance instructs all of our schools to perform that test again. If you receive the indeterminate result twice, then that means that those tests are corrupted for any particular reason. They're not viable, and so they should be discarded in our or in your regular waste disposal. Does anyone have any questions about that? Okay. Okay, we can move to the next slide. Okay, so what we do encourage is that for any schools that have a diminishing or dwindling testing supply with the BinaxNOW test, when you get to your final 20 test cards, that's the time when you want to submit a request for additional BinaxNOW testing kits through the BinaxNOW reordering link. And I think in a few slides prior to this one, we covered that it's located within the appendices section of our testing guidance. It's also available on our website as well. If you all, for some reason, cannot find that, then what you can do is send an email here to schooltesting.covid, and I will respond to that. Stacy will also respond and be able to assist you all in being able to order those. One of the things that I would like to note is that if your BinaxNOW kit arrives with a missing or a damaged reagent bottle, please contact me immediately at the schooltesting.covid email address to notify me of that. Unfortunately, our agency's warehouse and our shipping and warehouse staff, we do not possess the reagent bottles as a single unit on hand. Those are actually distributed directly from the manufacturer, which is Abbott BinaxNOW. So if you do find yourself in this, circumstance where, again, the reagent bottle arrives damaged or it is completely missing from the kit, notify me immediately, because there is information that the manufacturer needs. It will ask you a variety of questions on a very short survey, and then I will capture what you have provided to me as your responses. I will send that to my contact with Abbott BinaxNOW, and then they will distribute and ship that reagent bottle to your school. I can put in a request that it is shipped very, very quickly to make sure that you have it on hand. So just let me know if you all have any issues with that. We did in the spring semester, but I want to make sure that you all don't have that issue moving forward. Okay, next slide. Okay, so with the eye health self-tests, so again, as I stated a few moments ago, the eye health self-tests were provided to our schools multiple times in the spring 2022 semester. So initially, when we procured them and distributed them to our schools, they were in place to support enhanced exposure testing protocol, which was previously referred to as the test to stay enhanced exposure protocol. It supports this particular testing protocol or testing method specifically when BinaxNOW tests are not readily available, if the supply is very low, or if you all simply need to distribute them to ill students and or staff members to support that testing protocol. We also distributed them to all of our school districts during the, or prior to the spring break semester, and then a second time, during the spring break holiday, as well as directly prior to the end of the spring semester into the summer. These were very large distributions, and it was specifically conducted to support out of school time to ensure that families, students had access to free rapid testing when they were not in school. At this particular time, there isn't a plan in place that we have to distribute these tests in a large quantity or bulk quantity as before. However, as we continue to receive updates, of course, we're going to send out this messaging to all of our schools as well in the event that we conduct another large distribution of these tests moving forward. And please let me know if you all have questions about that at all. If you do still have eye health self-tests on hand, you're more than welcome to distribute those to students as well as staff members, again, provided that you're following the protocols within the testing guidance, okay? Okay, next slide, please. Okay, something to note, very important, with our diagnostic testing CLIA waiver, as a reminder, all of our testing is occurring under the OHA CLIA waiver, which is a certification of waiver. It basically allows for the Oregon Health Authority to support all of our 1,400 plus schools to be able to receive these testing kits and receive them for rapid on-site testing to ensure that we are mitigating the continual spread of COVID in the best ways and most rapid ways possible. Because of that, we need to ensure that our testing partners, so specifically our K12 schools, our educational service districts, long-term care facilities that are enrolled into our diagnostic testing programs, we have to make sure that you all as our testing partners are not receiving tests from outside entities. So one of the questions that I receive a lot is, there's a hospital who has donated some tests to our school. Are we able to use them? The answer to that is no. And unfortunately, because of our CLIA waiver, schools should not receive tests from outside sources, specifically because the Oregon Health Authority does not have a way to identify from whom the test arrives, specifically which manufacturer, any of that really critical information that our agency needs in order to track that vital information that we require to report to the state as well as to our federal partners. So if you ever receive an inquiry about tests being donated to you all, please say, no, it's okay. We have enough available, or we know where we can get some very quickly. Also too, if you have a surplus for any reason of Binax Now tests, please also do not donate them to neighboring schools, healthcare clinics, hospitals, etc. Again, if they are enrolled into our testing program, we will be able to swiftly and readily available get them the testing supplies that they need. Also, we have to make sure that they are, in fact, registered and enrolled for tracking data and reporting purposes. And if you all have any questions, please let me know. Okay, great. So we can move to the next slide. Okay, so this is, again, just reviewing the information that we have within our testing guidance. So there are 4 modules within the testing guidance that are required for our school testing administrator or administrators, if there are multiple ones, to complete prior to administering any tests on site. Within Abbott's website, you will see 6 modules for training. You're only required to complete the first 4. Also, there is the digital application that's available on that website that will encourage users to download that. The Oregon Health Authority does not recommend using that app to use it for training purposes or to track any data or testing or anything like that. You're only required to complete the first 4. Additionally, this training, for example, and trainings from the past should also serve as a tool for you all to be able to enhance your training. If you need additional training or have questions, of course, reach out to us at any time. And the next slide, please. Okay, so as a reminder, within your testing kit, you will receive 40 test cards, 40 nasal swabs. There should be 1 positive control swab. If you need more, I'm going to make this statement. If you need more, please send an email to me at the school's testing.covid email address, and I will be able to work with our shipping and warehouse teams to get you all more. There's also the 1 bottle of the extraction reagent. Again, if it's missing or if it's damaged, just email me and let me know. And then there's also the instruction card on there as well. So it's important to note that each Binax Now kit has its own lot number, and of course, as well as its own expiration date. If you all have any questions about that at all, there should be more information within the materials content section of I believe it's the instruction manual within the testing guidance. If you don't have that, I also have a separate document that I can send to you all as well. So if you need that for any reason, please just email me at any time and I can get that over to you. Okay, next slide. Okay, so this speaks to the storage and testing requirements. I won't speak to this very long because this information is within the guidance, but it's really, really critical that all of the Binax now tests, the test cards are stored in the temperatures that are between 35 to 86 degrees Fahrenheit. If the temperature is slightly colder than this or hotter, it's going to corrupt the test. And so the results will be completely invalid and not the best. It won't be able to capture whether or not someone has COVID-19 or not. One of the things that I have recommended in the past to many of our schools is that the school testing administrator and a reporter, but mostly the administrator of the testing process, should be the primary person who has access to these tests. You want to make sure that you secure them in a room, ideally the testing room if there is one on site, but you want to make sure that you secure these tests as well as the testing materials in a room where there's not a lot of traffic, there's not going to be a lot of people in and out, just to ensure that you're able to maintain eyesight over and control over the test in and of itself, okay? Again, you all have been with us for quite a while, so you know that the most ideal locations for testing would be either the nurse's office, a health room, or an isolated classroom or an office area. Again, it's really important that that the school testing administrator or COVID-19 testing team on site at the school has a protocol in place for testing to ensure that it's always conducted in an area where there's privacy, right? So again, not a lot of traffic, that the student and or staff member has privacy when they are being tested for those 15 to 20 minutes, which is the length of time that the test should take. And the next slide. Thank you. So this is speaking to your PPE or personal protective equipment. So again, you want to make sure that you have your disposable gloves, your reusable eye protection. So either a face shield or goggles will suffice. A disposable medical grade surgical mask is also required. And then you want to make sure that any equipment that you wear while administering the test will minimize any potential threat of exposure and protect the administrator from the possibility of infection, right? So you want to make sure you're wearing long sleeves. You want to make sure that there's not a lot of skin exposed during this process. Again, disposable gloves are required. It is necessary. PPE must be worn each and every time that a test is administered. There may be times when you have a cohort, for example, whether small or large, where you will have to test multiple students or multiple staff members at a time. You want to make sure that after each time you conduct a test, you dispose of the PPE that you have worn. The goggles and the face shield can be wiped down and cleansed, but gloves, any outer protective wear, you want to make sure that that's disposed of so that there's no possibility of transference of any infection either between the people that are being tested and or to yourself. So that's really, 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 really important to note. Okay, next slide. So with the testing area set up, of course, you want to disinfect everything prior to testing, the table, your materials that you're using, your hands as well, prior to using the disposable gloves. Also, you want to make sure it's conducted on a flat surface so that you can lay out all of your testing materials as well. Also make sure that it is temperature controlled. So again, if there is the possibility of, if it's conducted in a very hot setting or very cold, it's going to potentially alter the result of the tests. And that is something that, that we don't want. Again, a place that is that allows for privacy, not a lot of traffic. This is really in place to maintain the privacy and the security of the students and or staff that are being tested. Also, you want to make sure that you have a lot of space within this area so that you're not feeling cluttered or cramped and unable to turn around, because you may have your testing materials here. The person that is being administered the test, they may be sitting here. And if the space is too cramped, you as the testing administrator are not going to feel very comfortable in that process, nor will the student or staff member as well. Okay, the next slide. Oh, I think we skipped one. Okay, great. So this is the information that I went over previously about the indeterminate result. We have had this occur within several schools in the past. And again, that indeterminate means that that box of tests are not viable and that somehow they're corrupted and they are not to be used. So don't use any of those additional cards from the box. You can completely discard those when that result shows up. Also, if the quality control fails for any particular reason, you really want to make sure that you discard those as well, and then notify me so that you can have an additional supply of rapid antigen tests. Also, if you need additional positive control swabs, we do have those available, and those can be shipped to our schools and to our other partners as well. Okay, and the next slide, I want to make sure that I save enough time for additional questions that we have not covered. So I spoke to this previously. This is the testing log that is available. It's a downloadable form within our testing guidance. This is where you want to keep track of all of the tests that you have administered in this testing process. It's going to be really critical for you to use this and refer to it later on, especially at the end of the school year, or as it states within our testing guidance. If for any particular reason that the school testing site has to be audited by OHA. That has not happened to date, but again, it's just really great to make sure that you have this on hand and documented. Additionally, one of the questions that I've been getting over the last several weeks is, how long does a school need to maintain or keep the testing log on file or a part of their records? So what some schools have decided to do is to make a digital copy of this testing log and just include it in any of their COVID-19 testing folders or files. That is absolutely okay to do. This is yours, and it will help you just any event that you need to go back into the past and see any students and or staff members that have received the test, who administered it, what date, etc. So you can keep that as a digital copy, and then you can completely shred and discard the physical copy. Also, I should have mentioned this before. I'm going back a little bit, but I should have mentioned this before about the consent forms. Since the consent forms, a new one is required at the beginning of each school year. Once the school year ends, the existing written consent forms can be discarded at the end of the year, and those don't need to be kept on file for any reason. However, if you choose to do so, it's completely up to you all as your school. Okay, so we can move to the next slide. So with disposal, in the past, when we first started the program, schools needed to discard them in the special bags, but that's no longer a requirement. They can be completely disposed, meaning any used reagent bottles, of course, the test card itself, the swabs to collect the sample, your gloves once they have been used, all of those materials should be discarded in the regular waste disposal. If there are any other supplies that are within the testing kit that arrive, if those have been damaged, bruised for any particular reason and are unusable, those can also be discarded in our regular trash or in your regular trash disposal as well. Again, also discard your PPE too. Please, 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 please don't leave your PPE lying around, because it will definitely run the risk of contamination and infection, and that's what we're trying to mitigate. And next slide, please. Awesome. So this is the end of our webinar for today. This is these are our email addresses. So if you all have questions about the diagnostic testing program, any of those items, you can email me at the schooltesting.covid email address. If you have questions about screening testing, then you can email Stacy at the covidscreening.schools email address. And again, we are a team of 2. We work very, very closely together. So if for any reason you all send an email to the diagnostic testing email address, and I am either out of the office, or if there is a lot of amazing things going on in the world and I'm unable to answer within 5 minutes or so, Stacy will reply to you all. And the same is true for the screening testing email account as well. Again, thank you all very much for joining us. If I have overlooked or missed any questions, please let me know. And now we're going to open it up for questions at this time. If there's anything that we did not cover, any questions that you all have, does anyone have questions for, I think that they may still be on the line, any of our screening testing partners or our laboratory partners?
Hi, this is Denise. Can you hear me?
Hi, yes.
Hi. So I'm at a school and I had typed in the question in regards to the consent forms that we have. So
Oh, yes.
do we go to OHSU to figure out how the participants get the kits and the labels for their kits? Is that what I'm to understand?
Hi, Denise. So
Hi.
I'm going to get you connected with OHSU on the logistics on how they are on your pickup days and how they want those consent forms. So I will get you connected right after this
All right.
meeting.
Thank you so much. Appreciate it.
Hi, this is Lori Thompson. I have another question on the, I can't even think of it, the little swabs that are in the, like the gray foil packets. Okay, do we use that with the regular card? And if that shows positive, is that our sample, if you will, to find out if the tests are all still good?
The
gray, there was a slide with it back about 5 or 6, 7 slides that showed.
Right. And it comes, that comes in each of the Binex Now testing kits.
Yes, that is correct.
Yep.
So swab out and we use it in a regular card and it should always be positive.
Yes, that is correct. So that is the positive control swab. If I am thinking of the correct slide that you're referring to, that's the positive control swab. And so that's used during the quality control test. And so that will show the viability of the test itself. So you want to make sure that you use that. And again, if that is not working, if it's been corrupted for any reason, or if it's missing, please let me know. We have had a couple of those factory issues that have come up. So if you have any issues with that at all, just let me know. I can get that adjusted for you.
Okay, thank you very much. Thank you.
Yeah, of course. Thank you, Lori. Does anyone else have a question, need assistance with anything that we can help with right now at this moment? All right, well, thank you all again so much for joining us this morning. What we are going to do is to, as soon as it is available, send out a copy of this webinar training. In addition to the recording, it will also be available on our website. And so once you get the notification, please feel free to share with all of your schools, everyone who's on your COVID-19 training team. And again, if you have questions, please let us know and contact us anytime. And thank you all so much again for being with us and being our community partners once again this year. We're really excited to continue to support you all and also all of Oregon's schools as well. Oh, of course. Thank you so much, Lori. Thank you. Thank you, everyone. I hope you all have a wonderful Friday and a really great and safe weekend as well. Thank you.